I was diagnosed with colorectal cancer when I was 36. I felt fine, I didn't feel sick, and I thought, surely I can't have cancer. My first thought was, okay, once I accepted the fact that I did have cancer, I needed to get the best team together to be able to fight this cancer.
We treat over 8,000 new cancer patients on an annual basis and have over 40,000 individual patients in follow-up on any given period of time.
But it has developed over the past 10 to 15 years to one of the largest programs in the world. We're one of the largest oncology programs in the world. In fact, I think we're the third or fourth largest now.
That growth has been enormous over the number of years and is really a testament to the world-class programs that we have in bone marrow transplant, in neuro-oncology, and breast cancer, and lung cancer, and other kinds of programs.
When I made the appointment and met with Dr. Fleshman, he was excellent explaining the procedure and also gave the option to do this procedure laparoscopically. It was also my understanding that, that Dr. Fleshman and Siteman was the only hospital in the area that did offer this procedure.
Well, here you have world-class experts in each of the specialties associated with a particular disease. So you have expertise that does not exist in other institutions.
This is one of the greatest research institutions in the world, without a doubt. It ranks third in NIH funding. It's got a tremendously large clinical service.
My lymph nodes have been in some of the studies that Dr. Fleshman has been working on. If I can be a part of that, it would make me feel good having gone through what I went through. Not only obviously for my own survival, but to help others as well. I had 100% confidence in my physicians, in the hospitals that I chose, and I felt like I had the best team of doctors, helping me to overcome something that could be very scary.
Seeing people who are desperately ill get better is probably the most satisfying aspect of this, because it doesn't happen overnight. It happens over months or years, and it's a lot of work for everybody, but the end result is the most satisfying part of being an oncologist, I think.
I work out, I'm back to working full-time. Pretty much am doing everything that I did prior to my treatment. 3 years later, I feel like I have my life back.